Here are the 6 keys to double your patient retention rate. I use an acronym called RESCUE. R is for results. In order to get your patients to come back again, you need some results on the first visit. Of course, you can't take care of everything on the first visit. They might not get 100% pain-free in the first visit, but they need some results. You need to do something, not just writing a prescription for an anti-inflammatory, but do something that will get them better, some results immediately. Next thing is education, and that's the key with this, educating the patients on the problem, what they have, the options of treatment, and educate them on why they need to come back. Probably the number one reason why patients don't come back, they start feeling better. Why do I need to come back? My copays are $50, $70 at a pop. They have a high deductible. So why should they come back and spend more money? And so educate them on what you are going to do at the next visit. S is service. Provide great customer service. And that starts off with when the patient calls on the phone, making the appointment, making them feel comfortable. You know, there's really 3 reasons why patients don't keep their appointments, and that is time, fear, and money, and also the necessity. Why, is it necessary for me to come back? I don't feel a sense of urgency. So time, fear, and money, which you need to handle on the first phone call, that you are flexible with that appointment, okay, of types. You have different types for that patient. So that's time, fear, will the doctor make me comfortable? And that's where your staff needs to come in and say, hey, I know you have this problem. It sounds very painful. I want to let you know that doctors here are very, very good and gentle. And that helps overcome that fear. And of course, money and educating them, knowing that you're going to verify the benefits beforehand, that they will be educated on their finances before treatment is rendered to the best of your ability. And that's great service. That is getting the patients in the room on time. And that also is great service and answering all their questions. C is communication, and this is everything I'm saying right now. Communicate with the patient everything they have, and just listen. That's what we need to do as doctors. Listen better. Your staff needs to listen better. And the next thing is use ultimate flexibility. If you're strict on when you need to see these patients and they don't have the time for that, make sure you get them in. Make sure you have time for that. Do your best to get them in and get them in on time, and you see them on time. So be flexible with their needs. And we really have one policy, and that policy is to do everything you can to keep that patient happy and healthy, as long as it is legal and ethical. And the last E is efficiency. We talked about being on time. That's very important, but being efficient, having staff that can answer their questions, and having your office being a well-oiled machine. It just runs really smooth, and being efficient throughout all the processes. If they need surgery, scheduling their surgery, getting back to that patient. If they need to know something, if they ask you a question, if they left a message, be efficient, get on the phone and speak to them. So RESCUE, if you follow these 6 steps, you will double your retention rate and you will increase your profitability by doing so. So stay focused, go ahead and implement these ideas.